Despite efforts from government agencies and advocacy groups, we are now entering the third decade of the opioid epidemic. According to the U.S. Centers for Disease Control, there are three main waves to consider when talking about the epidemic. The first wave began in 1999 with an increase in opioid prescriptions. The second wave started in 2010 as heroin overdoses began to increase. Then the third and current wave started in 2013 with the increasingly popular use of fentanyl and other synthetic opioids. What is most striking about the three waves is that they converged around 2013 to lead to a drastic increase in overdose death. Those deaths continued to rise, resulting in more than 30,000 overdoses in 2016, according to the CDC. With these daunting numbers in mind, the volume of opioids declined from 2013 to 2017. The total volume was below 200 million in 2017, reaching that mark for the first time in at least a decade. The main reasons for this decrease are threefold: changes in clinical use, new regulatory and reimbursement policies, and new legislation. Between 1999 and 2010, heroin overdose deaths were fairly stable, averaging about 2,500 per year. However, between 2011 and 2018, that number skyrocketed to an annual 12,000 deaths. The epidemic is also a problem in all types of areas in the U.S., from large cities in the Northeast to the more rural municipalities in the Deep South. And that brings us to our current wave, fentanyl. Fentanyl is a powerful narcotic that is between 80 and 100 times stronger than morphine. Originally created to help cancer patients deal with pain, the advent of this class of drugs quickly led to rampant abuse. In 2016, deaths from all three waves, fentanyl, heroin, and prescription opioids, were above 15,000. While we understand there is a problem that is leading to the countless deaths, it has been difficult to make a significant dent in the epidemic. In 2017, more than 17% of people in the U.S. had at least one opioid prescribed to them. However, the average number of days per prescription did increase from 2016 to 2017. The epidemic has also affected the older generation, as opioid-related inpatient stays increased 34% between 2010 and 2016 for individuals older than 65. In 2017, there were more than 70,000 drug overdose deaths, with the age-adjusted rate of overdose deaths increasing by 9.6%. Also, a total of 23 states, including major population centers California, Florida, and New York, saw their rates worsen from 2016 to 2017. Getting out from this epidemic has proven challenging, if not impossible. The government has put out programs aimed at helping people with addiction, but it is unknown whether we are truly at the end of the opioid epidemic.